Hello, everyone. My name is Orla Higgins, and you are very welcome to this discussion on the patient effect. The film was made under the Science and Screen funding scheme, and this began in 2015. And it's a partnership between Quorum, which is the SFI Research Centre for Medical Devices at NUI Galway, and the Galway Film Centre. And the whole aim or the whole point of the funding scheme was to engage new audiences and different audiences in science and to find the stories and to find the people within the world of science itself. And for this particular production, a new collaborator and a new partner came on board in the form of PPI Ignite, and more of which we'll hear about anon. So I'm delighted to be joined today by three great panelists. We have Cameron Caron, we have Martha Killalay, and we have Mia Malarkey. So I thought what I would do is I would just go around to each one of you and just get you to introduce yourselves really briefly. Cameron, I might start with you.
Perfect. Thanks so much, Orla. So my name is Cameron Keekern, and I am a youth adult panel member with the D1 Now study, which was featured in the patient effect. I'm also a PhD in NUI Galway, and I'm delighted to be part of the panel today.
Great. And Martha?
Hi everyone, my name is Martha Killalay and I work with the HRB Primary Care Clinical Trials Network and PPI Ignite in NUI Galway. I'm delighted to be here today and I'm representing the two groups. So PPI Ignite and the Primary Care Clinical Trials Network were involved in the development of the patient effect and the co-funding, which was the funds were delivered by the Health Research Board, the primary funder for healthcare research in Ireland. Thank you, Orla.
Brilliant. Well done for remembering all that. And last but not least, Mia.
Hi, so my name is Mia Malarkey and I am a filmmaker from Galway and I'm the director of The Patient Effect. So I got to work with Martha and Cameron and everybody else that was in the film. So hello.
Hello, great, and thanks a million. Mia, I'm going to go to you first because you were involved in another Science on Screen project, weren't you? The Feats of Modest Valor.
Yeah, so Science on Screen started in 2016 and myself and Alice McDowell applied in that first year. And yeah, we were delighted to get the grant. And so we made a film about Parkinson's disease and it just introduced us into merging science and cinema and sort of finding that language because, you know, you have to be a good storyteller, but you also have to really understand the science that you're getting into. And of course, each area of science is quite vast. So it was a great starting point for us, I suppose. And then Alice and I stayed collaborating on this project as well. So she produced this film and I was the director. And yeah, I think it kind of readied us for, you know, working with scientists, working with patients, working with like a huge different number of people and just getting our heads around how to make that information really accessible to the audience.
Yeah, because I suppose what's different, slightly different about this one is that it doesn't focus on one particular condition or one particular disease. It kind of comes at it from a completely different angle of looking at how the patients, the carers, the families end up being co-researchers. I suppose they describe it in the film. But that must have been a completely different type of challenge. How did you tackle that as a filmmaker? How difficult or different was it to get that slightly more abstract concept maybe on screen?
Yeah, I mean, I guess what we knew would work was to make it really people focused, and that's how we've always done. So this is like it's our fourth sort of science documentary project, myself and Alice. And in a way, the story, the concept suited us because we already would have wanted to focus on, you know, the patient or the main subject of the story rather than putting the science first. We sort of portray the science through the human story. So in a way, the PPI angle suited what we would have done anyway. But yeah, it is a challenge because it is about a concept rather than an individual or a science project. So that's why we thought maybe having 3 different research projects, you'd really get a big picture then about what PPI can achieve. So like with
that kind of struck me as well because, you know, it was almost like 3 things. It was one, it was like kind of how we deal with medication. The other part was almost like how we deal with language, and the third part was almost like how we deal with systems and the health system itself. And it really gave it that kind of rounded overview, I suppose.
Exactly. And also each of the 3 research projects were at a different stage in terms of their PPI. So like I was just going to say with Cameron's research and with the diabetes, they had already done 5 whole years and they were sort of coming to the end of that and they'd achieved a huge amount. So that was a really nice way to finish our story then, because it was like there's an early stage, then there's someone that's right in the middle of the sort of PPI research, and then we got to the end and what it can accomplish. So it sort of seemed like it was very challenging to have so many stories and so many subjects packed in, but it seemed like a smart way to portray all of what PPI is.
And Cameron, I know at the time, you were super busy. You were like vice president and education officer at the student union, and you were involved in these advisory panels and all your advocacy work. And really, why did you decide to take part in the film on top of everything else that you were doing?
I think it was important to show the benefits of PPI and how, as patients with a particular disease, you can have such an impact and influence over research that is ultimately going to affect your quality of life down the road. And we talked a bit briefly beforehand, but about this idea of who's the smartest person in the room. And oftentimes the patient is dismissed as not knowing much about what they're doing. But through the work that we do with D1 Now and the other projects that were featured, you could see how patients have a very unique understanding of what they're going through, and what treatments are going to be beneficial for them, and breeding this culture of co-creation and co-partnership was really important for us in D1 Now, and for me as a person that's living with type 1 diabetes, but then being able to kind of show that to the wider world, it was a really exciting opportunity that I don't think anyone on our team would have wanted to miss.
And it's interesting, just I suppose tying into your experience as well and from the film, at the beginning we were seeing, Margaret, isn't it Margaret, and she was talking about how she loved to go dancing and that she couldn't go dancing, and then we saw, or only for a little bit, and then we saw Alice and Liddy going out to the support group and coming back and saying, doctors they had never mentioned sleep, they had never mentioned mobility to her, and this was a complete eye-opener. And I suppose really what it brought out was that gap between the scientific experience and the lived experience. So why was it important, Martha, then for PPI Ignite to get involved, and how did you guys get involved and say, yeah, we want to get involved in the film industry?
So that's a great question, Orla, and something that very much put us outside our comfort zones as researchers and things like that. Film isn't something that we would be all that familiar. The production of film isn't something we would be all that familiar with. We'd be more so familiar with going to the cinema and things like that, being the viewer. So the Primary Care Clinical Trials Network has a PPI group that was developed in 2016. So the PPI group and the researchers within the network decided that they wanted to come up with some sort of tool that could act as an educational resource, a long-term educational resource, to tell the story of PPI, to tell the public, and also to tell researchers why PPI is so important and why it should be done, and to portray that PPI can be done at different levels. So it is, as Mia was just saying, it's not a scientific thing. It can be done so differently. There's different levels of the spectrum of involvement is very different. You can go from informing to consulting to involving to partnership. So in the documentary, you can see Cameron and the D1 Now panel being co-researchers in partnership with the D1 Now study, and you can see Margaret and Alice and Liddy and the Swinford Walking Group acting as a consulting group where she's going to them for advice, and you can see Alison bringing their input, so say for example the side effects and things like that, back to Professor Martin O'Halloran and Dr. Conor Judge, the researchers in the lab, on how the medical treatment should be provided. So through different conversations, the PPI group and the researchers decided that they were going to apply for a grant from the Health Research Board to fund a film that would tell the story of PPI and could be used for a diverse population to a broad audience. And when doing that, Del Murphy got in contact with Claire Reardon, who is working in Durham, and we found out about Science on Screen, and we said, we watched the previous films, Bittersweet Beats Small Splatter, and it was something that we were really interested in combining the two ideas together. So we did, and fortunately, the Health Research Board saw promise in our idea and funded it, and we went from there. So it was very much a co-designed idea from the primary care PPI group, PPI Ignite, and the Clinical Trials Network. Everyone came together and felt that this was the best way to move forward.
And Mia, what was it like? You obviously worked very closely then with PPI and with Martha and her team. What is it like as a filmmaker when you work so closely with funder, but yet they're also the source of all the people that you're going to be talking to, or a lot of the people? How was the process for you? Was it different to the way you work with other films?
Yeah, it certainly was. I mean, there's one or two projects in the past that had a similar structure, but it's not the common process. But I think what was really working for all of us was the film was a kind of call to action. It was like a way to let the public know PPI is really important, it's really doable, it's rewarding. And I think because we were all on the same page with it being a call to action, it meant that the collaboration kind of flowed and worked really well. Like obviously there was challenges along the way that, you had to show a rough edit to a lot of people and wait for all the feedback to be collated and then go back to the edit room and, but you're always going to meet those challenges with the filmmaking process anyway. But I think like when we did our interview before we even got the project, our pitch was like, this is a call to action. We want to tell a story that will encourage people who may not even be a patient of any kind, but just to realize how easy it is to participate in research and how impactful it is on the scientific community and on the community at large, just to actually understand, that your voice is really relevant. So I think when we pitched that in the interview, it was a really good starting point. And that was always the motivation for like us working with Martha and all the team in PPI and all the science teams as well. So I think
that cohesion certainly came across on screen anyway, having watched it. How did you find the process, Martha?
I found the process really interesting. So there was an info day where different filmmakers came and heard different stories of PPI and what PPI is about and things like that. And then, as Mia just said, they wrote a proposal and there was interviews. So it was very much like a mini funding application. The process was really interesting. There was a big team of us. The Ishka Films, and then of course everyone who was in the film. So I suppose you were just kind of aware that you wanted everyone to be represented how they wanted to be, and Mia and Alice at Ishka Films just pulled it out of the bag. It's just I think from everyone who has just watched it, I feel you would agree that it is a story. It tells a story of public and patient involvement on how patients, families, carers, anybody, any member of the public can get involved in research. It really enhances the research, especially in the medical health and social realm. It really just enhances everything, brings it to another level. So people who are going to be affected by research should be involved in the development, the decision making of the research, and that really comes through in the documentary. The call to action has been met.
Yeah, you really see the benefits. Cameron, when you were taking part, I mean, you were so honest and upfront just about, not just partaking in obviously the YAP. I think that's a great name for the panels, actually. Brilliant. But you're so honest about your own personal experience and managing your diabetes and the impact that it had on your life, just going around the day-to-day kind of base and the levels of anxiety in terms of dealing with the system and all of that. And did you find that difficult to do? Did you find that difficult to talk about? Did you find that difficult to be filmed talking about that?
I think and I've said this to a few people around filming the documentary. It's very weird filming a diabetes appointment with, an entire film crew in there with you. But that particular appointment, and I've said this to Dr. Sean Janine, who's in the film as well, that it was the best diabetes appointment I'd had in years, because we were using the intervention that the YAP and the team had developed. But even though it was for a documentary, he still made it an actual real appointment for me. And so I felt really comfortable to be open and honest about the struggles. And I think, especially when you get into the young adult realm, it can often be difficult to talk about, okay, I've been managing this disease for nearly a decade, but I'm still not necessarily on top of it, or I'm having a really rough time at the minute with it. And I think that the documentary, in a way, allowed me to have that openness with the clinician team around how I was feeling, but using the intervention that we had been involved in designing. But as well as that, like, it also allowed my family to kind of have an insight into what living with type 1 diabetes is like, because I'm the only one in my family that has type 1 diabetes. And so they were really involved. Mia and her team made sure that they could be involved in different ways with the film process. But when they watched it, they could kind of understand to a certain extent that, okay, maybe I don't understand exactly what my child is going through with this particular disease, but now I can have some sort of insight to it. And I think it provided that kind of pin drop moment for a lot of patients who are watching it to be like, actually, maybe it's not about the scientific things that I'm seeing. Maybe it's not about the blood sugars or the blood test or the whatever other medical test. Maybe it's actually about what the patient is going through and how they're feeling. If we can address that, maybe we'll see better effects down the road. And I think that's one of the really great things that I'm really happy to have been a part of it for, because I hope that those who've watched it today and those that will watch it or have watched it can take that from it, that there's a huge benefit to having patients involved, and it will reframe what you think is important in the context of care, and ultimately provide more benefits down the line for patients.
And the moral of the story is to bring Mia to all your medical appointments, is it?
Yeah, I'm going to have to do that in the future, Mia, so I'll let you know when the next one is.
I'll be there with the camera. But also just to say, Cameron is actually amazing to document, because you're so articulate and you were very embedded in this research from the beginning. So your passion kind of comes through. So it's not like we had a lot of work to do. We just had to, stay on the ball, and that was really it, which was great. And it was lucky because that Pride Parade happened when we had planned to shoot. So we were like, nice. We get a little bit of like who he is in the real world and like your family. And so there was a nice serendipity to just the events that were happening around that time.
Yeah,
and your family are great.
Yeah, with all the, and supposed to go back to Margaret and her dancing as well. Do you know what I mean? It really portrayed like the fact that one decision that that somewhere away in a lab that somebody is making just affects everything that goes on for a person, like 24/7. And is this kind of a revolutionary idea then, Martha, in Ireland? Like, I mean, how good are we at this? How good are we at this? These kind of interventions of, almost making the patients, families, the carers, the co-researchers with the scientists and the medical profession.
So PPI has been around for a long time. It hasn't been as largely used in Ireland as our counterparts, so say the UK, but it really is up and coming. So the Health Research Board have really raised the profile of PPI in Ireland and in some of their grants. So if researchers want to do research needs to be funded. And if you want to do research in the health and medical realm, you'd be funded by maybe the Health Research Board or Science Foundation Ireland. The Health Research Board now have in a lot of their applications, the majority of them, you have to outline your PPI plans for your research. And you should be getting input from these people, from public and patient contributors before you submit your application. So even, from just idea generation, rather than when the research is actually happening, to be bringing these people in, for your research questions. So in research, when we're looking at things in research, we'd call it a primary outcome. So say if we're looking at stroke, for example, and you're looking at what medications increase chances of coming out of hospital after having a stroke, that could be your primary outcome. But there was a project that was done around stroke where the people who had strokes and their families, their carers, said the primary outcome for us is when these people can come home and how long they can live at home for a quality of life. And that completely changed that research project. So the researchers changed their whole idea and started to do it for the people who had the strokes and their families, that they would be able to come up with ways to address that. So it's important that it's done, from the beginning, and, in a meaningful way. It's very important when you are bringing people to the table that you're giving them a voice, and it's not just a tokenistic tick box. I'm doing this because I should be doing this, or it looks good to do this. And I think, Mia and Alice really showcased in the documentary that every PPI contributor who is involved in them 3 studies it's so meaningful, and they are empowered. The studies are empowered. The research is better because of that.
Yeah, and I love that idea that it's part of the process even before the process begins, because it's not just, as you say, a tick in the box, we'll stick it on at the end, and then people are just paying kind of lip service to it.
Yeah, that's so important. So the Health Research Board funded an initiative called PPI Ignite in 2018. They funded PPI Ignites in 5 different universities to build the capacity of PPI in Ireland, and they're getting that has been a really good resource for researchers and also for public people in these areas to link in with, to get involved in PPI.
And Mia, just for the other contributors that you were dealing with, you know, what did they feel? Did they feel it was a beneficial process in terms of engaging in the research and being able to feed back through those support groups? What impact did it have on them?
It was quite huge, really, for everybody. Like, certainly, you know, Sophie and her family went through something very traumatic, and that, you know, they had to pick up the pieces afterwards and just, you know, work through that. So for him to be able to go and contribute to other families' well-being and to contribute to research that might help other families, he gets so much reward from that, you know. Like, it really does, as you say, Martha, it really does empower him, because he can't go back and change his experience. And he was fortunate that they come out, you know, so Sophie came out really healthy from her experience. So he wants to be able to give something to other families who are going to go through that same experience. So for him, it was hugely rewarding, you know, like, you know, again, as with Cameron, it wasn't like we had to push hard for anything to happen. The passion was there and the enthusiasm was there. We just had to be smart in how we followed it, you know. And the same with Margaret.
That tugging on the emotional heartstrings when you watched her and her dad, you know, together, and
Yes.
the family together, and the way he spoke about it, and just, I suppose, the emotional impact it had on him in a very beneficial way to be able to contribute.
Yeah, it's huge. And then with Margaret and the walking group in Swinford and Mayo, you know, I think one of the things they got was a better understanding of chronic pain. And, you know, they all got to have this lovely conversation where they could be quite frank with each other about what, you know, the emotional stress of chronic pain, as well as the physical stress. And then to have this, you know, a scientist who really understands the biology of it, have a really open conversation with them. They all really enjoyed that afternoon. And then also for Margaret to feel like she's contributed, it was the same as with Paul and Sophie and all of that. It was like, you know, it's not just you anymore, and it's not just your suffering. You're actually going to help your, you know, other humans down the line. So I think it's hugely rewarding. And we even felt that ourselves as the storytellers. We're just the conduit, or the, you know, we're the messenger, but we could feel this idea like other people down the line who are suffering are going to benefit from these conversations and this input. So yeah, definitely with all 3 stories, you could feel they felt very empowered by what they were sharing.
And you'd agree with that too, wouldn't you, Cameron?
Yeah, definitely. I think from our young adult panel, like, one of the things that we recognize is that we have a really good opportunity to influence and impact on young adult type 1 diabetes care, but that it's not necessarily going to impact us, but we want to leave the health system in a better place than maybe we found it in for ourselves. And I think that's something that you can get a lot out of PPI research, is that maybe you're not going to influence your own care to a great degree, but you'll be able to make sure that no one else has to go through the struggles that you went through. And I think a lot of the other YAP members feel that as well. And as you can see in the kind of the story, like, a few of us have been involved for a while, and we're kind of aging out of that particular YAP panel and moving into maybe other things. And so we can see the benefit for the younger people coming into the YAP of what we've done, even in how a YAP works, that a lot of those teething issues that maybe we had at the beginning are able to overcome, or we're able to mentor or give advice to the younger YAP members as well.
Yeah. And of course, you've moved into your professional life as well. You work in the whole area of medical research. You're doing your PhD. What are you focusing your PhD on? You've just started, haven't you?
Yeah, so I've just started. So I'm a few months in now at this stage, but I'm looking at Parkinson's disease, which obviously fits into the first film that came out of Science on Screen. And so it is something that I'm conscious of in my own research, that as it gets to a point where I'm looking at maybe influencing the disease model of Parkinson's, where can I go to get information or advice from people suffering from Parkinson's disease or their families, to ensure that I myself am not doing research without consulting those that are affected by it. So I think it's a good way to start out a research career, to have that experience and to understand the importance and the value to having patients involved in research as well.
I think this is brilliant because we can see it going full circle, can't we? Just here, you know, people are involved in the research from one perspective, and now you're going on and doing the research. There's filmmakers making it, there's people funding it, and it's just brilliant. And Mia, the music was amazing. I know I might be a bit biased here because the very same person composed music for a recent podcast series I did, which I was so thrilled about. But it's a family affair, isn't it?
Yeah, and I'm delighted to plug my sister Anna. So she does all of my, yeah, she does. She composes for everything I direct, and she's just brilliant. She if you go to her house, it's basically just, I think she has 11 synthesizers or some absurd number. So every room has synthesizers everywhere and speakers, and yeah, it kind of just looks like a film set. It doesn't look like a house at all. And then she obviously brings in musicians, and she's great as well, because I'll say things like, okay, Anna, this is a poignant scene, but it's a little bit, you know, it's going to start out small, but it's going to get really upset, and then I want it to get really peaceful, and she'd be like bonking away on the synth. And so we have a lovely artistic collaboration that we've built up over the years. So,
yeah, it's fantastic. You're a very talented family. It's great to see. And Martha, would you do it again? Would you get involved in this type of film process again?
Absolutely. Me, my colleagues, we can go out to community groups, we can go to patient organizations and stand there for half an hour with PowerPoint slides and talk. And that is never going to be as effective as showing a documentary like The Patient Effect. We'll never be able to articulate it the same way that that it has been in The Patient Effect. It's been absolutely incredible. And just when you were talking about going full circle, it really has gone full circle. It is now going to be used in undergraduate education for people who are going to be medical professionals. So, you know, who are going to be dealing with patients in a clinical setting. Also, we're showing it to researchers, so they will get involved in PPI, showing it to members of the public, to patients, so they would get involved in PPI from that aspect. So it really has gone full circle and is being influential in all pieces of the jigsaw puzzle. So absolutely, we couldn't be happier with the end product.
Wow, well, I can't think of a better note to finish up on. So I think we're actually out of time, unfortunately. We could talk about this for a long time yet, but it's just great to see such a positive result from it. So thank you very much to Martha, to Cameron and to Mia for joining me today on the panel. And I'd also like to thank all of you for tuning in to watch this very special Science on Screen Festival event, and hope you get to catch some of the other screenings as well. Thank you.